Hi, this is Dr. David Greene with the Arizona Pain Network, where we bring you anything and everything education for pain management. Today the topic is PRP therapy for knee osteoarthritis. PRP stands for Platelet Rich Plasma, and it has become very popular in pain management over the last few years, whereas it's been used for decades in other areas of medicine, such as cardiovascular, ophthalmology, urology, wound care. But more and more studies are showing that it has a lot of use for musculoskeletal conditions. So one of those came out late last year from the Hospital for Special Surgery, and it was published in the Clinical Journal of Sports Medicine. The study looked at 22 individuals from the ages of 30 to 70 who had the beginnings of painful knee osteoarthritis. The average age was about 55 years. And the arthritis showed up in multiple compartments. Sometimes it was in one compartment. They didn't confine it to just say, we want it to just be in the medial compartment. No. It could have been either in the patellofemoral, between the kneecap and the femur, or the inside or the outside compartment. So that was not an exclusion criteria. They did one platelet-rich plasma injection. Well, just a brief aside, what is platelet-rich plasma? Okay, well, all it involves is taking a simple blood draw, like you would at the lab, from a patient, between 20 and 60 cc's of blood, okay? It goes into test tubes that get spun around really fast in a centrifuge machine. Eventually, the blood ends up in 3 layers, and the top layer is what is used. That has a lot of platelets in it, has a lot of growth factors in it, and that's called platelet-rich plasma, okay? So it's your own blood, and it's being re-injected at the same office visit into the area under consideration. Here we're talking about an arthritic knee. So they injected about 6 cc's. So you start with 20 to 60 and you end up with 6. So it really spins it down a lot, okay? Now that gets injected, and they looked at clinical outcomes at multiple time frames during the first year. They also looked at functional outcomes. There are certain instruments that you fill out. Can you walk this far? Can you do these activities of daily living? And what they found is all across the board, patients improved. Their pain levels dropped significantly. Their functional ability increased significantly. And one thing they also did was they looked at MRIs serially between the initial injection and then multiple time frames thereafter. Studies have shown that usually when you have knee arthritis, people lose between 4 and 6% of their cartilage each year. But what they found in this study was that 73% of the patients lost no cartilage according to MRI over the span of that year. So it's very significant sounding, but they didn't have enough patients to reach actual statistical significance. So the end result conclusion was that it sounds like PRP might be very helpful for those with early to mid-stage osteoarthritis that's painful, for both pain relief, clinical function increase, and maintaining the cartilage that you have, and maybe growing some more. But what they need to do is a larger study. There have been studies in cows in the past with PRP showing that in them it did increase cartilage formation as well as calling in stem cells. That's a lot of what PRP does, is it has platelets, it has growth factors, and it calls in the body's stem cells. And the theory is that it can help repair or regenerate damaged tissue. Okay, so very exciting study. Arizona Pain Specialist is offering PRP therapy for soft tissue problems such as epicondylitis, tendonitis, but also for conditions such as this, osteoarthritis in the knee. A lot more information on our website at preferredpaincenter.com. You can click on PRP, platelet-rich plasma, and read a lot more about it. Okay? You can also read about stem cell injections and a lot of other exciting things on the conditions and the treatments. I'm Dr. David Greene with the Arizona Pain Network. Your pain stops here.